Tell me again, how many cases of malaria the percentage of your school children, what do you think, how many of them already had a case of malaria?
Oh, cases of malaria, we could get maybe at the peak. There's a season when the number of malaria rises, and that depends with rain and water. There's a season which is a lot of rainfall, there's a lot of water, so there are a lot of breeding places for mosquitoes, and the number of malaria patients rises so much, so it could be maybe 6 people a day. So if you multiply by the number of 7 days within a week, not less than 20 people in a week. Yes.
How many tests do you make a day?
I could make, depending on the season and the symptoms, not less than 5 a day.
5 a day?
Yes, most times.
And how many of the tests are positive then?
Sometimes it's half of it. So maybe around 8 people, maybe 4 to 5 could be positive when the season is high.
Yeah.
And when it gets low, you can get 2 or 1 person a day. But it's hard to finish a week without having a malaria patient. Yes.
But what are the symptoms?
Symptoms of malaria, the biggest ones are headache, fever.
How high is the fever here?
It could rise from 38 to, sometimes could be high grade, 38.5 and above. Yes. Yeah. So mostly it rises during the night. So you could be fresh during the day, but when it reaches night, around midnight, you could feel severe headache and fever and general body weakness. It's accompanied sometimes with vomiting, nausea.
Okay.
Yes. And those are just the symptoms of non-severe malaria. But when it gets severe, the symptoms could get worse, and it could involve something to do with the brain. So a person can be confused, disoriented, and that's cerebral malaria.
Okay.
Yes. Another symptom for severe malaria, it's vomiting everything.
Okay.
So that requires the patient to be admitted and given injectables instead of oral medication.
Okay.
Yes, and the other symptoms could be low blood glucose. So somebody becomes so weak because they fail to eat, so they become so prostrated that they even can't sit without support.
Okay.
Yes, and the other.
How do you do the diagnosis, by microscope or?
Yes, it has 2 ways of diagnosing. The first one is by rapid test.
Okay.
So you just prick and take a small sample of blood and put it on the test kit with some buffer in it. Then after putting the
That's always the first what you do.
At what?
That's the first. The first thing is this rapid test.
Yes. The first thing you do is a rapid test.
Oh, you can go to your phone, of course.
I can just silence it. I can just silence it. I can silence it.
That's no problem.
Okay.
Yeah.
And after the rapid test, when it turns positive, you have to go for microscopy. Although sometimes it's not that much necessary, but it is required to be done. So mostly it helps with monitoring, surveillance to know if the medicine had worked or not. So if somebody was diagnosed to be positive and microscopy was done, blood sample was taken for microscope and the number of parasites was counted. So after using medication, there can be a repeated test of microscopy where they count the number of parasites. Are they the same or more than before the person began using the medication? Or have the medication eradicated every parasite so that we can say it worked or didn't work?
Okay. So.
Yes, so mostly it's the 2 tests. Other tests are just the supportive tests depending on the symptoms. Example, some could become pale because malaria, another symptom of severe malaria is anemia. So as we know, the life cycle of malaria parasite, they tend to rupture the red blood cells. So the patient may become so pale. So we can do HB, hemoglobin test. So we can do random blood glucose and the likes. So some other symptom of severe malaria is jaundice.
The
Jaundice.
jaundice, I don't understand the English word.
Okay, jaundice is there is a deposition of bilirubin throughout the body.
Oh, yes, okay, yeah,
Yes.
okay.
Yeah, so the person becomes yellow.
Urine becomes very dark.
Yes,
Okay,
yes.
yeah.
The mucous membranes, they become yellowed.
Okay.
The palms, the feet, everything becomes
Yeah.
yellow. Yeah, so that's the other symptom of severe malaria. So it could be a lot.
How many of your clients do you have to send to hospital?
Roughly, it's just 1 or 2 because most of people here.
1 or 2% or?
No, I mean, all the patients that I have encountered, only 2 of them had gone for referral because they were under 5 years. So as we know, under 5 patients their immunity is a little bit lower. So most of them they get convulsions, febrile convulsions.
Okay.
Yeah, but because of this environment, people who have naturally grown here are exposed to malaria almost every time. So it's hard for them to get severe symptoms compared to people who came from regions with no malaria at all.
I see. Okay.
Yes. So mostly it's that.
Yeah, interesting.